Okay, so what we're going to have a look at now are the metatarsals, okay? And we've got 5 metatarsals. So if I just bring up my pen, first, second, third, fourth, and fifth metatarsals, okay? We'll have a look at the first and the fifth separately because they are slightly different. So thinking about the second, third, and fourth metatarsals, what are some of the key anatomical features of these? Well, the bases of the second, third, and fourth metatarsal bones are wedge-shaped and are wider above than below. The bases of the second and third metatarsals articulate with the intermediate and the lateral cuneiform bones respectively. Okay, so the bases of the second and the base of the third are going to articulate with the intermediate and lateral cuneiform bones. Remember, this is the medial, the intermediate, and the lateral cuneiform bones. The second metatarsal is the longest and articulates at its base with the intermediate cuneiform bone and at the sides with the lateral and medial cuneiform bones. Okay, so it also articulates at its sides with the lateral and the medial cuneiform bones. And also on the lateral side of its base, it also articulates with the third metatarsal. The fourth metatarsal bone articulates at its base with the cuboid, there, and at its side with the third and the fifth metatarsal. Now the heads of the second, third, and fourth metatarsals are narrower than their bases. They have a convex articular facet which extends further onto the plantar aspect than the dorsal surface. The shafts of the second, third, and fourth metatarsal bones are slightly curved, being convex towards the dorsum of the foot. The shafts are a little compressed from side to side and have a rounded upper surface and a sharper plantar border. So they are roughly triangular in cross-section. So the shafts of the second, third, and fourth metatarsals are relatively triangular. Now, thinking about the first metatarsal bone, it's shortest but the most massive of the metatarsal bones. The base has an articular surface which articulates with the medial cuneiform bone. The lateral side of the base does not articulate with the second metatarsal. The shaft is thicker than the shafts of the other metatarsal bones, and the undersurface of the head of the first metatarsal bears 2 grooves which contain sesamoid bones in the intact body. The fifth metatarsal has a triangular articular facet which articulates with the cuboid. So there's an articulation between the base of the fifth there and the cuboid. The lateral side of the base of the fifth metatarsal bears a prominent tubercle which projects backwards and laterally. So there's the tubercle of the base of the fifth metatarsal. The shaft and the head of the fifth metatarsal bone are similar to those of the second, third, and fourth metatarsal bones. So let's think now of the phalanges. And remember, we've got 1, 2, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. So we've got a proximal and a distal, a proximal, an intermediate, and a distal then along the second, third, fourth and fifth, but the first, the great toe, only has a proximal and a distal phalange. The proximal phalanx of the big toe is larger than those of the other toes. The base of each proximal phalanx has a concave articular surface which articulates with the head of the corresponding metatarsal bone. The head of each proximal phalanx has two condyles, which bear a pulley-shaped articular facet, which then articulates with the base of the middle phalanx. The shaft is slightly curved and slightly convex downwards. Now, thinking about the middle phalanges are shorter and thicker in comparison to their length and in comparison to the proximal phalanges. Again, the base of the middle or intermediate phalanges or phalanx has a concave articular facet for the head of the corresponding proximal phalanx, and their heads have an articular facet which articulates with the distal phalanx. Now, the distal phalanges have concave facets on their proximal ends which articulate with the corresponding phalanx, and the distal ends are expanded to support the nail and the soft tissues of the toes.